Have a sore throat? Think that it's strep? Well, my name is Mandy Cameron. I'm a board certified family nurse practitioner, and I wanted to give you a little bit of information on strep throat. So oftentimes when patients have a sore throat, they wonder if it's strep or a bacterial infection, and do they need an antibiotic? Well, there are different causes for sore throat. You can have a viral sore throat, a sore throat related to allergies and postnasal drainage, and then you can have a bacterial infection with strep. There's different forms of strep, and strep A is the most common. One sure way to know if you have strep is with a simple strep swab, and that is a rapid swab that is done in clinic, and we can swab your tonsils or your throat and see if you have that bacteria in your throat. Sometimes a throat culture is needed to be sent out to see if you have strep throat, as there are other forms of strep. If you have strep, some of the things that you might see are very red in your throat. Your tonsils are swollen. Exudates, or what people call pus pockets on the back of their tonsils. There might be lymph node swelling as well. Fever is very common. In children, there might be a lot of gastrointestinal symptoms. So think nausea, vomiting. Also, a lot of times children will come up with like a sandpaperish type rash. If you look in the back of their throat and you see little type small bruises at the top of their palate called palatine petechiae, this might indicate strep as well. Bad breath, a white coating on the tongue. Now, oftentimes these things can be present in a viral sore throat as well. The best way, like I said, is to see a provider and get that swab. Sometimes a provider can make a diagnosis just based on the appearance of a throat. As well, it is important to remember that you can have co-occurring illnesses like COVID and strep or flu and strep, but strep in and of itself is not going to present with, coughing and lots of the upper respiratory symptoms besides that if it's truly just strep throat and no other illness. So that's another thing that's important to remember. Anyways, I hope that this information is helpful. If you have a sore throat, it is helpful to take some anti-inflammatories like ibuprofen or Motrin if it's appropriate. You can also take Tylenol for pain and fever. Do some warm salt water gargles. And if you have strep throat, typically an antibiotic is needed to help heal that up. After 24 hours, you're going to want to change out your toothbrush and make sure and finish your full course of antibiotics if you're diagnosed with strep. So if you have a sore throat, I hope that you feel better, and I hope that this information was helpful for you. Have a good one.